There are various types of surgery to remove hemorrhoids. Most of them can be done as outpatient surgery, allowing you to go home the same day. One type of hemorrhoidectomy involves the doctor making small cuts in the anal area and cutting them out. Normally this is done under general anesthetic, although in other cases local anesthetic is used. There is a good chance that you will experience some form of pain afterwards, but you should be able to return home the same day. Things should start to heal within 2 to 4 weeks, but can occasionally take up to 6 weeks. During this time, you will probably need to take painkillers, such as paracetamol. This type of surgery is successful, but there is a 1 in 20 chance that the hemorrhoids will return. This is however far lower than non-surgical treatment. With this operation, the surgeon reduces the amount of blood reaching the artery. The surgeon will insert a small ultrasound probe into the anus. This probe sends out high-frequency signals that let the surgeon find the vessels, which supply the blood to the hemorrhoid. The surgeon will then put a stitch near the hemorrhoid, cutting off its blood supply, and making it shrivel and die. You may experience some pain after this operation, and there is a low risk of some bleeding, whilst going to the toilet afterwards. Laser surgery is another solution. During hemorrhoid laser surgery, the surgeon will introduce a Doppler probe into the anus, through a special disposable proctoscope. The surgeon will then fire 4 or 5 pulsed laser shots to each artery to shut them off. You need to do this for each hemorrhoid. Anesthesia is not normally required for this surgery. During rubber band ligation, the hemorrhoid gets tied off at its base using rubber bands. This in turn cuts off the blood supply to the hemorrhoid. This treatment is only for internal hemorrhoids. The doctor will insert an instrument called an anoscope into the anus. Then a device places a rubber band around the base of the hemorrhoid, and about a week later, the hemorrhoid should die and fall off. You will get a scar at the operation site, and this in turn, will stop nearby veins enlarging. This procedure can normally be done in the doctor's surgery. The bands can cause pain if they are too tight, but a substance can be injected into the hemorrhoid to ease this. Lower abdominal pain is also often associated with this operation. You may also feel strongly that you need to pass a stool. In a doctor's office they will only normally remove a maximum of 2 hemorrhoids. The only way to remove a lot of hemorrhoids in one go is under general anesthesia. If further treatment is required, then this can be done after 4 to 6 weeks. Paracetamol will help with pain relief after the operation. You will probably also get some bleeding. Using cryosurgery to treat your hemorrhoids, the doctor will firstly add local anesthesia to numb the area and will then start applying either nitrous oxide or liquid nitrogen with a cryo probe. Before freezing the hemorrhoids, the surgeon may also tie them off. The hemorrhoids should shrink and fall off in 2 or 3 weeks. This type of treatment can often cause a lot of pain afterwards, plus there is a risk of infection as well as a risk of bleeding. Cryosurgery is nothing like as popular as it used to be, and most doctors now use a different treatment because this treatment can produce many side effects. The most popular hemorrhoid coagulation therapy is called infrared photocoagulation. The doctor uses a high-intensity infrared beam which in turn, creates fibrous tissue on the hemorrhoid. This then cuts off the hemorrhoid's blood supply. This treatment is mainly used for the smaller hemorrhoids. There is a chance of pain during this procedure, and they often reoccur in about 1 in 20 cases. Your physician may choose sclerotherapy, specifically to treat small internal hemorrhoids, where rubber band ligation won't work. He will inject into the base of the hemorrhoid, this then hardens and stops blood from getting to the enlarged mucosal tissue. This then dies and eventually drops off. This procedure needs a very skillful doctor. As you can imagine, there are numerous home remedies for hemorrhoids out there, some better than others. We have researched hemorrhoids very thoroughly over many years, so are very careful what we recommend. For us to recommend something, it has to have been proven worldwide, with thousands of patients, over several years. We only recommend one natural treatment. If you are interested in reading more about it, I will put the link across the screen now, and there is also a link in the description below. Good luck.